to hear from another NHS patient. This time it's a cancer patient, Delony Carlisle from Sevenoaks, and Dean Russell is going to ask Delony a few questions. Dean.
Thank you, Chair. Delony, first of all, I hope it's okay to call you by your first name. Delony, first of all, thank you so much for joining us today. As a cancer patient, I don't expect you to go into details of your diagnosis, of course, but would you mind sharing your experience, especially over the past few months, and how you felt during that time about your care?
Sure. The lockdown coincided for me with a period of quite serious ill health. And I have to say, I've had more contacts with the NHS than I could count. I've had 3 admissions via accident and emergency. I've had a lot of contact with community and primary care services. And finally, there's been an issue around planned care. So shall I take you through those 3 areas?
If you could briefly, that'd be wonderful. Absolutely. Thank you.
So accident and emergency, I think my experience has been fairly similar to the experiences that you've heard outlined today, in that I met very empty departments. Obviously there was sort of deal of trepidation, the known risk of, well, I was feeling very unwell and I needed an accident and emergency department, but was I going to be exposing myself to the virus? So go along with some nervousness, but I found really it was quite a safe environment. In that there was lots of separation, there was immediate hand sanitation, everybody was masked and gloved. It felt actually a very safe environment. The accident and emergency departments were very empty, there was nobody there, so I was able to get through in double quick time. And when I talked to nurses afterwards, really astonishingly fast service, they said, yeah, we are really worried because people are not using the A&E departments. So I think a very similar experience that you've already had outlined. I think something that you maybe haven't touched on is the way in which community and primary care services have changed. So I've had a lot of telephone contact. I had a really interesting experience when I was needed to contact an out-of-hours GP because I had a skin rash. Was able to get through to out-of-hours GP. We sat and looked. She didn't want to bring me into a waiting area. She didn't want to expose me to any risk. So we sat and looked together at a New Zealand dermatology website. Does the rash look like that one? Oh, yes, it does. And we were able to diagnose that it was shingles. She sent prescription electronically through to my pharmacy. So from first contact to me having medications in my hand and starting to feel better was 3 hours. All done via the telephone. I've had consultations with my GP by the phone. That's been terrific. With community nurses, I also have lymphedema, so being able to do a consultation with my lymphedema nurses by telephone. That's not ideal because there's a certain amount of there's some physical things that need to happen in a lymphedema consultation. They actually need to do measurements, but as a stopgap, that's been okay. So there's been lots of changes in the way that I've worked with the community and primary care services.
Have you felt? Oh, sorry. Have you felt that that's been in an odd way an improvement on the way that it was pre-COVID, or have you felt that there's been more challenges there that need to be overcome?
Both. Certainly it was much easier for me not to have to go out to a waiting room, sit in a waiting room at a point when I had shingles, feeling very unwell. It was actually great to be able to make that diagnosis on the telephone. I felt quite safe in that diagnosis, but I mean, ideally, really, a doctor should have had a look at that, I think. So I think it's come as a way of dealing with things in a crisis. Yeah, absolutely, totally acceptable and had advantages, but I'm not sure that it's a good long-term one. And it also depended on me having the internet. If I hadn't had the internet in my house, if I wasn't able to call up that website, if I wasn't confident in what I was looking at on a New Zealand dermatology website, that wouldn't have worked. So it was dependent upon me being able to do that. So
And
combination.
And with that in mind, then, so I mean, are there any learnings from this that you think moving forward, should be taken, continued? Obviously that's one area where for some it wouldn't work. But are there things that you felt, especially from a patient perspective, where you think actually, what, this could continue in this way, or other areas where you'd say absolutely not? It caused you concern or anxiety, as it were.
I felt fine in all the contacts I've had with telephone, with community and primary care services, with the proviso that this has been in an emergency situation, in the COVID situation. Yeah, some of it could definitely go on, and GPs are doing telephone consultations. I mean, we all know that, and I think some of them have been fine, but definitely, I think to move everything over. There are times when you just need to see your doctor. They need to eyeball you.
Yeah, absolutely. And we've got some incredible experts on the select committee at the moment, which will obviously the chair will be coming to questions on shortly. But is there anything that you would like to say to them in terms of from a patient perspective, where you think things could be improved?
I'm not sure. And I think a successful telephone consultation requires quite a lot of confidence from a patient side.
Yeah.
I think you have to be quite confident in your ability to talk about what you're experiencing as symptoms. And I think quite a lot of care needs to be taken with extending what's happened in the lockdown to what might happen further on. But I'm not entirely sure anyone's really pushing for this. I don't think patients are really pushing for telephone consultations, and I'm not convinced doctors are either. But I mean, really, I can only speak about my own experience. That's all I've got.
Well, and can I say a huge thank you for joining and sharing that experience?
There's an aspect that we haven't touched on at all, which actually I think is really, really important, which is what's happened around my planned care. Is I started the lockdown in a clinical trial. I had a CT scan. The clinical trial showed that all my cancers were growing, and my doctors told me that I needed some chemotherapy. I then fell into a hole where I was absolutely in limbo. I didn't know, I'd had no communication about when this chemotherapy might start. So for most of the lockdown, I've been sitting here at home, knowing that all the cancers are growing, knowing that the tumours in my lung, in my liver, in my spine are all busily growing, and absolutely no word at all from the hospital about when some treatment might start. Now, I'm a single mum with teenagers at home. My priority is to stay alive. And I can't tell you how difficult that limbo period has been. It has been resolved. I have heard from the hospital, I have started my treatment, but I do know, because I do a lot of work with Macmillan's online community, I do know that there are a lot of people who are still in this situation, who are waiting to hear about planned treatments, who've been told that they need chemotherapy, who've been told they need other treatments, and have absolutely fallen into a hole of limbo and have not got any word about when their treatment might go ahead. And they are absolutely in a terrible situation. I don't know if you can imagine how hard that must be.
I can't actually. Absolutely. Well, thank you so much for sharing that story, and I'll hand back over to the chair.